Hello, guys, welcome back, and I hope you all are doing absolutely fine. So, recently, I got many messages regarding this topic about how do we write the applied homeopathic part in the medicine paper, which is like generally asked in 20 markers, right? So, just to make a brief video and introduce you all to the video thing. So, basically, there are many different parts which are generally asked. One is scope and limitation. Then we have auxiliary measures, then the ancillary measures. So there's a difference between auxiliary and ancillary, and we'll be discussing it in that video. And the last one, which is the most important, which I feel is miasmatic background prescribing, right? The miasm of the disease. So basically that also, if you have the basic understanding of the miasm, that becomes quite easy, because in this you have to remember one thing, that there are no such fixed pattern on which we can write the answer format, because every disease has a different miasm, and that miasm you can only get through know if you have done the therapeutic part or the disease part very well, or if that topic has been covered in your colleges, right? Because for example, if I want to give an example, asthma, you cannot write soric, because asthma is purely psychotic, right? So if they ask you the miasmatic background of asthma, then you need to one second. So if they were asking you the miasm of asthma, so the answer will mostly revolve under psychosis, right? And the most important psychotic remedies like medorinum, okay? Then we have natrium sulf. These will be the remedies indicated here in cases of asthma. Also arsenic as well, because it's trimasmatic and it covers many miasms, like it covers mostly all three miasms, more towards sora and psychosis. But yeah, so for example, if you see asthma, then it is purely psychotic, okay? Because this Hahnemann sir himself have mentioned in the chronic disease. So to have that basic idea of chronic disease is very important. So there are many videos on YouTube which you can watch on chronic diseases and get a basic understanding of the miasm, sora, psychosis and syphilis, which I'll be covering later on in the video. But yeah, so this is one part of it. One second, guys. G. So miasms part come in, and lastly the acute prescribing and the chronic constitutional prescribing. So again those topics are again very self explanatory, because acute में अगर कोई पिक्चर आया तो आप उसकी acute totality लोगे. acute totality में आप जो भी आपकी presenting totality है, the presenting totality, and उस पर आप prescribe करोगे. Wherein in constitutional method you will take the whole picture of the patient in mind, which complains of the common complaint, chief complaint of. Then we get into the generals. In that we have all the likes, basic proforma, which is like, dislike, aversions, the appetite, which is good, the basic appearance of the body, the constitution of the body, the tongue, the nails. Then we move on to the thirst, then any allergies of food or anything like that. Then there are habits. Then we move on to the stool, urine, perspiration, sleep pattern, positions on which the person sleeps, and lastly the dream part. Then the past history, family history, right? So you can brief the answer in that pattern, which is the whole constitutional history taking, which is basically done in chronic cases. But suppose if a acute acute attack comes off, or if there is an acute miasm coming up, then again we take the whole acute history, and then we stop the constitutional medicine for that time, and then we give the acute indicated remedy. And when the acutes settle, then you can again start back with your chronic prescriptions, right? So that's the whole basic gist of it. Then so yeah, basically all these points are generally asked. So now we move on to the main theme. So I'll just point out few points which you need to remember in scope and limitation. Basically scope में हम लिखते हैं कि कुछ बेसिक पॉइंट्स है जो आपको हर एक आंसर में एज डिफ़ॉल्ट बाय डिफ़ॉल्ट लिखने हैं as a understanding point, is that homeopathy treats the patient as a whole. So it is not a very symptom specific diagnostic science. It is a science which deals and treats the patient as a whole. So it's a very holistic science. Homeopathy is based on the law of similia similibus curanter. In homeopathy we get a wide range of symptoms during proving, and we get that opportunity to apply it on a sick individual in various conditions, right? So homeopathic treatment is very similar on and is based on the law of similia similibus curanter, which means let likes be cured by like, and it has a great scope in acute as well as chronic cases. Homeopathy has been considered Also to be useful in cases of surgical cases like stones, piles, fissures, fistulas, right? And homeopathy is very good as there are no such differences on structural and functional levels, right? And treatment of congenital disorders and different scopes, like mostly अगर आपको स्कोप के बारे में पूछे तो again, like I said, that it is a very individual specific answers and there are no fixed pattern on which you can write. But of course, like I have mentioned these points, that you have to mention the first two lines, that it is a holistic science, it treats the patient as a whole, and the similia similibus currente principle which we have, and the nature's law of cure, right? We treat the patient naturally through the nature's law of cure, which is given again in aphorism 26. So this is one part of the answer. Then again you can add the points depending on the time that you have, because you have to remember that out of the 20 markers hardly 7 से 5 से लेके 7 मार्क का आएगा बराबर अप्लाइड होम्योपैथिक पार्ट. उसमें भी देयर वुड बी डिफरेंट क्वेश्चंस आर, सो यू कैन राइट दी लाइक 2 मार्क्स का डिफरेंशियल होगा, 1 मार्क का अक्यूट प्रिस्क्राइबिंग होगा एंड 2 मार्क्स का मैज़म होगा. सो 2 मार्क में आप स्कोप एंड लिमिटेशन कैसे लिखोगे वो आप अपनी तरीके से उसको आप जस्टिफाई कर सकते हो. आई वुड सजेस्ट दैट मे बी हाफ और लेस देन हाफ ऑफ द पेज वुड सफाइस, राइट? So again the limitation part which comes in. So limitation, you have to state the, I mean, convey some facts which are sometimes true, and there are still doctors who treat patients in emergency in homeopathy as well in their homeopathic clinics. But by default, in general, when we are in our OPD setups, homeopathy has less scope in emergency cases like accidents, drowning, poisoning, etc. But of course, then again, there are always options available wherein people treat. But in general, मोटे मोटे में हम याद रखना है कि generally in cases of acute emergencies, we refer the patient to the hospitals which they take care of, right? And once the patient is stable and the vitals are clear and normal, we again go back to our homeopathic treatment. So homeopathy has limited scope where there is advancement of pathology, like suppose if there is a case of advanced CA cancer, then palliation is one of the only options that we can think of, and cure is very rare in such cases like the grade 3 and grade 4 of cancer, right? So we need to know our scope and limitation as well. It has a limited scope in artificial chronic diseases. Again, there is no scope in absolute surgical cases like fracture, cesarean section, cataract, etc. There is no homeopathic medicine which works as a contraceptives. Then there is limited scope which is lacking in the cases like wherein any vital organ is involved, suppose in cases of acute MI. Now of course there are many drugs, amyl nitrosamine and different drugs which people use to case like the golden period which is available for the patient. So in that you can still give the homeopathic medicines, but it is better to not take any risk and call the ambulance and refer the patient to the nearest hospital without any risk or taking any stunts, right? So this is the basic part of scope and limitation which we have in here, right? Then there is a auxiliary measure ka 5 marker or a 2 marker, I mean 2 marker ka weightage ka point can come in your 20 marker. So auxiliary measure and ancillary measures. So auxiliary measure are certain additional steps that are occasionally apart from appropriate medical treatment and in general management of a case. So generally auxiliary measures include diet charts, exercise, therapy, hygiene, health hygiene information or awareness, sleep, weight, management of your sleep cycle, your weight cycle and your body general weight is quite conveyed to the patient and made him understand so that he can live a better lifestyle. If one of the above stated problem, I mean the pointers are causing any lifestyle disorders, then the patient has to be advised and counseled. Certainly some of the common auxiliary measures include avoid unnecessary stress, control obesity, see there should be a cessation in excessive smoking, chain smoking, and even regular smoking is not allowed. But the patient who suffer from smoking addiction, it's very difficult task to leave the habit, right? So you have to advise patient step by step, gradually you can try to reduce the number of cigarettes and then you can eventually stop, and you can take all the necessary auxiliary help as well with that thing. So avoid spicy and fatty and oily foods in cases of hemorrhoids, piles, fissures. Then maintain a balanced diet, sleep well, keep your sleep cycle well. Then there is a unnecessary drugging of medicines should not be done. The self-drugging which most people do in homeopathy, that should be avoided. Then please drink adequate water. Then there should also be means in your lifestyle which can help you reduce stress, that is again through yoga, pranayam and exercises. Then we move on to the ancillary measures, right? Ancillary measure. So ancillary services are the diagnostic or supportive measures that the physicians may use to treat a patient through physical therapy, X-ray, lab diagnostics, ECGs, USGs, and etc. etc. Generally, these can be broken down into three categories. Diagnostic services. These are performed in hospitals to supplement the work of a primary physician, like laboratory test, radiology, audiology. Then we have therapeutic service, which focuses on providing immediate information on a patient, like the physical therapy, occupational therapy, speech therapy, psychotherapy. And lastly, the custodial services. Custodial services support the patients while keeping them independent as possible, like the nursing facilities, home health care services, and the basic hospital care. So now we move on to the miasmatic understanding of the disease. Let's discuss some common points of miasm. So in SORA, like I'll not be writing all the points here because it becomes like the video will be lengthy. So I'll just note down the few points which you need to remember while writing your answers. So miasms are generally the basic obstacle to cure because the prominent miasm which the patient is having currently, which is exposed, needs to be treated properly. So it is a true and a fundamental cause of the disease. Therefore, depending upon the miasm, selection of remedy has to be done. There are three main types of miasm in homeopathy, and the fourth one, which is added later on: Sora, syphilis, psychosis, and tuberculosis. Sora. So these are the basic points of Sora which we need to remember when we write the answers. So when you're writing an answer on the disease part as well, please mention some introductory points of Sora, like Sora is responsible for the functional changes in the body. Sora miasm concerns basically with inflammation, irritation, infection, and hypersensitivity. Causes of psoric miasm generally could be due to irritability, anger, fear, sensitivity, anxiety, worry, and anticipation. And the patient is sensitive to disturbances. So the senses generally comes to Sora, right? Then we move on to psychosis. Psychosis generally basically growth and overgrowth of the tissues. So that can be generally, you can see it like in cases of what generally doctors prescribe thuja. So what is thuja? Thuja is a very great antipsychotic remedy or the king of antipsychotics. And what is what? Basically, what is a generally overgrowth of a on a surface, right? So psychosis is a developed due to the suppression of gonorrhea. Psychosis miasm concerns generally with stenosis, growth, proliferation, thickening, chronic inflammation, and tumor. Patient is sensitive to stress, and the cause generally of psychotic miasms or the ailments from or the exciting cause could be grief and from loss of money, position, loved ones, power, disappointment in love, prolonged grief, anger suppressed, business and household cares and worries. Then we have the syphilis, which we taken point of. So syphilis again is most destructive miasm in all three. Destruction is generally the cause of syphilis. There is a lot of hemorrhages, infections, terrible pain, night aggravation, which is generally marked in syphilis. The night aggravation, the bone pains, hysterical temperament, hysterical sensitivity, and again tumors. And the cause again could be many. For example, honor wounded, sudden anger, rage, fright, panic, strong angers which are suppressed, or strong emotions which are suppressed, and they can lead to a lot of suppressive things. So now just to add on to the disease and the miasms. So guys, if I were to give you examples about from where can you learn the miasmatic understanding of disease, so there's a very good book by Miasmatic Understanding by Dr. Banerjee. So you can refer that book for your miasm understanding of each disease, because practically it is very difficult for me to explain you all the disease. But please keep in mind that some of the psychotic manifestation of miasms of our 20 markers, in which there is asthma, which is generally very psychotic in miasm. Then we have ulcerative colitis and stuff like that. So the transition from Sora to syphilis, that evolution of the miasms which come in ulcerative colitis, right? So there's also Sora from where the disease begins, and it reaches the stage of destruction in syphilis, wherein there are formations of ulcers. So like that you can correlate with your basic understanding of miasm. But keep this in mind that in majority of all the diseases, Sora will be the most prominent, right? And the points which I've discussed above in Sora, just remember that. And I'm sure that if you know the organon property of your for paper 1 and paper 2, you can easily write the applied miasmatic and the applied part of medicine in your 20 markers, because generally, to be very honest, there is no hard and fast rule in which the teachers expect you to write a certain set of question answers in this format. But it's all about how well have you understood your own concepts, and the whole part is basically conceptual. So please keep your concepts very strong of miasms. सपोज कि सोरा में क्या क्या पॉइंट्स आएंगे, साइकोसिस में क्या क्या पॉइंट्स आएंगे, ट्यूबरकुलर में कौन से पॉइंट्स आएंगे. लाइक इफ देर आर रिकरेंट बॉइल्स एंड रिकरेंट इन्फेक्शंस, देन ट्यूबरकुलर miasms come in. If there is a lot of ulcerative destruction, then the syphilitic miasm will come in. If the patient mentally is suffering from a lot of depression, anger, this that suppression, then the psychotic miasm, along with the growth and the overgrowth of the body tissues like dandruff or any other tumors as such, lipoma or warts or any excrescences, then those land up into the phase of miasm of psychosis. And the basic starting point of all the miasms and the disease begins from sora, and the evolution which goes on depends on disease to disease, right? So the sora base is always constant in all of us. So this was the basic idea and understanding about how to approach the answers. Like, I hope it has made some sense to you. And yeah, if you like the video, please do share it with your friends giving the final year examinations, and please do like, share and subscribe our channel. It will motivate us to make more and more such videos for you all. Till then, goodbye and take care. Thank you.